How do past surveillance methods impact cancer care today? Imagine a time when doctors kept handwritten records of every patient's visit, treatment, and follow-up. That was the beginning of systematic cancer surveillance, which laid the foundation for today's advanced care. Early efforts by organizations like the American Cancer Society helped standardize how we track cancer outcomes, making it easier to see what treatments worked best over time. These early records showed us the importance of monitoring patients long after initial treatment, especially for cancers like testicular, cervical, and reproductive cancers. One of the biggest breakthroughs was the development of screening tests. For cervical cancer, the Pap test became a game changer in the early 20th century. It allowed doctors to detect precancerous changes before symptoms appeared, leading to earlier treatment and fewer deaths. This approach has saved countless lives and remains a key part of ongoing surveillance. For testicular and other reproductive cancers, physical exams, tumor markers, and imaging scans have become routine tools. These methods help catch recurrences early, which is crucial for successful treatment and long-term health. Large cancer registries, like the Surveillance, Epidemiology, and End Results programs started in the 1970s, have been instrumental in collecting data on how often cancers occur, how patients respond to treatments, and survival rates. This wealth of information helps doctors develop better guidelines for follow-up care and recurrence monitoring. For example, knowing that regular screening and follow-up can lead to earlier detection of cancer recurrence influences how healthcare providers plan long-term care for survivors. Past surveillance efforts also showed us that a patient's screening history impacts their outcomes. Studies have shown that women who undergo regular mammograms tend to be diagnosed at earlier stages of breast cancer, which improves survival. This understanding encourages ongoing surveillance and personalized follow-up plans. Today's technology builds on these foundations, using artificial intelligence and machine learning to analyze large datasets, improve detection, and tailor treatments to individual patients. In the context of living with cancer, these surveillance methods help monitor for recurrence and manage long-term health issues. For testicular, cervical, and reproductive cancers, protocols now include regular checkups, imaging, and blood tests to catch any signs of returning disease early. These protocols are continually refined based on decades of data, ensuring survivors receive the best possible care. In summary, the surveillance methods developed over the years have created a detailed map of how cancer behaves and responds to treatment. They have helped establish routine practices that improve early detection, guide treatment decisions, and support long-term health. Thanks to these historical efforts, patients today benefit from evidence-based strategies that increase survival and enhance quality of life. Always remember, if you or someone you know is navigating cancer care, consulting healthcare professionals is essential for personalized advice and the most current treatment options.